because it's not in the soil, and most of us are not supplementing, then by the time you get to your mid-40s and 50s, you will be experiencing some sort of arthritic symptom. But it's not because you are getting older. It's because you've been that dysfunctional for such a long time that at that age, your body just starts to break down. And so that's another myth buster. And so if we can say that arthritis is not hereditary and it is reversible, guess what? It's reversible for anybody at any age. And that's very, very powerful information, because now you have some new ideas about how you can move your health forward and not feel like you have to suffer with arthritis for the rest of your life, because you don't. And so because we're in this cultural dynamic of what everybody thinks arthritis is and how Western medicine portrays this or perpetuates this idea, we have to look at the treatments of today. And so the treatments of the day are very interesting. I'm going to give them to you, but not in their specific order of how they work. But let's do that. The first treatment is always going to be pain meds, because the first symptom is you go to the doctor and you say, my knees hurt, my ankles hurt, my back hurts, my hip hurt, my hip connected to the shoulder bone, and it all gets a mess. And the first thing he goes, well, okay, let me write you a prescription for pain. But before they write you a prescription for pain, they might actually give you recommend some over-the-counter stuff. And so I'm going to go back a little bit and explain to you why that's not a good idea. The other thing that happens because of it is we might get steroids, and steroids help reduce inflammation, which creates pain. Inflammation presses against the nerve. And then at the very last resort, we get surgery. And so in our society and our culture, we deal with a malnourishment or a nutritional deficiency illness, which is arthritis, which is brought on through inflammation. We deal with it through pain meds, steroids, and surgery. And so I just want to give you some more information about those three and explain to you that if you are considering any of those options for your arthritic symptoms, you might want to rethink those, because those are only going to compound your problem, and here's why. In 2008, a study of orthoscopic knee surgery for arthritis, a procedure that's performed hundreds of times a year, has been shown by the New England Journal of Medicine to not reduce pain or improve any knee function at all. And so this study was so profound that some orthopedic surgeons actually stopped practicing. They took their hands off of it. Knowing this information, other doctors continue to operate. And so here's the part you have to think about. If research has already shown that surgery for arthritis, specifically knee replacement, does not work, and doctors still do it, it's incumbent upon you to know the variables so when they recommend it, you can say no with a straight face, with no apology. And that's what natural medicine does. It promotes a sense of autonomy for your own health. You are the captain of your body. You make your own decisions. However, you can only make those decisions when you are well-informed, and that's what this call attempts to do, is to give you more information. And so here's this idea of getting surgery. Why does surgery not work? Well, it's a very easy, no-brainer answer. If the cause of your inflammation and pain is due to malnutrition, and you just mechanically fix a knee, you have not stopped the mechanism for why the knee was broken in the first place. And remember, we have 360 joints all over the body. And so if we don't arrest the root cause of the problem, then it's going to be the other knee, and then the hip, and then the other hip, and then fusing of your spine, and then fusing of your neck. And then when does it stop? It doesn't stop. It only stops when you can understand and see the correlation between nutrition, minerals and mineral cofactors, how bones and joints are supported and bones break down and build up and all those other biochemical reactions. That's the real key to making sure that your bones overall stay healthy. But in our culture, we get surgery. And so that's why you're not going to do surgery. Here's another one. There's an interesting discussion that I wanted to bring out. And that you might be saying to yourself, well, if doctors know this, how come they don't tell us? Well, Newsflash, your doctor went to school to be able to write you a prescription and do surgery. That is his life's blood. So therefore, it would be counterintuitive and counterproductive for him to tell you something that goes against the grain of what he's been taught to do to make a living for himself. And that's why you have to be that much more confident to make your decisions based on informed knowledge. And that's what these calls serve to do. And so moving on to the next one, steroids. A lot of people take steroids for the inflammation. Steroids are notorious for reducing inflammation, and so the common ones are prednisone and cortisone. What they do is they do a lot of different things, but one of the things that a prednisone and cortisone shot does, it accelerates the loss of minerals from the bones. And that's the exact thing that we're trying to stop. We want to rebuild the integrity of the bone in order for you to be healed, but instead, steroids impede the loss. It makes the loss of the bone happen quickly. Another thing that does that is eating carbonated beverages, and that's something we'll talk about at the very end. One of the other things that steroids do is it subdues your immune system. As a naturopathic doctor myself, I do hair tissue analysis. And when I do a hair tissue analysis, one of the things that I see when I'm looking at the biochemistry, I see calcium and magnesium ratios. And calcium and magnesium specifically dance, I'll use the word dance, they dance together to keep the pancreas healthy. And so if you're taking a prednisone or cortisone shot or any steroid shots or pills, what it does is it antagonizes calcium, making you have a artificial diabetic tendency. And so now you have a diabetic tendency that's brought on by a drug. And so if you continue to take, or if you're already taking a steroid drug and you weren't diabetic before, you take it a little longer, you'll notice that your doctor say, well, yeah, I think you're diabetic and we're going to have to give you another drug. And you're like, how did that happen? I have a good diet. Well, it was the steroids that caused that. So that's one of the reasons why you don't want to do steroids. And so now we're looking at surgery doesn't work. That's been proven by Harvard Medical School research in 2008 and in 2002. We're looking at steroids, and so what they do, they impede absorption, and they create a problem with your immune system. It can give you a diabetic tendency. Here's the last one. And after I tell you about this, you can be like, well, what can I do? Well, I'm glad you asked, because I'm going to tell you. Pain medications. This is a scary one. We are so used to taking drugs, we don't even really appreciate the danger of the drugs that we take for granted. And the drugs that we take for granted are over-the-counter drugs. Over-the-counter drugs that we take for granted are the things that we take every day. And so that would be aspirin. Everybody thinks, aspirin a day, and aspirin could kill you. Because if you take too much aspirin, it can cause bleeding of the stomach and eventually death. If you take Tylenol, there's 50,000 cases of kidney failure per year for people taking Tylenol. There's 5,000 of those cases that get so severe that they can lead to kidney transplant. And so we're talking about your over-the-counter CVS Tylenol. It's not harmless. Now we're looking at ibuprofen, Advil, and Aleve. These cause liver disease in 2 of the 5 users. Even liver cirrhosis if you're not a drinker. How is that possible? Because if you were on the call 2 weeks ago, we talked about liver and kidneys, you'll remember that everything you put in your mouth goes into your liver. However, if you're malnourished, not only do you have an arthritic problem, you also have a liver problem because your body does not work in isolation. And so when you are not feeling well and you think you only have one dis-ease state, don't be deceived. There's a lot of other things going on in your system. You might not be able to feel it. And sometimes you can't feel it because things are buried so deeply into the cell, they no longer signal. And so briefly, as a naturopath, I teach my patients there's 6 phases of health. There's 2 phases of expulsion. The expulsion phase is anything you can feel, sneezing, wheezing, coughing, itching. When I hear people say that, I'm happy because that means that their body is still signaling, and if the body is still signaling, we can work on things pretty quickly and have them move in a positive direction. When the body stops signaling, it goes into the inflammation phase. So inflammation is not always bad. Inflammation is a form of protection. Inflammation becomes bad when it lasts too long and causes cell and bone damage. And that's what we're talking about with arthritis and the different things in arthritis. A A lot of times internally, if we're talking about organs, inflammation is asymptomatic and you don't feel it. If inflammation lasts too long, then it moves into the degenerative phase. The inflammation and the degenerative phases are both asymptomatic, and that's when the disease really takes hold and you can't even feel it. And so if you say unto yourself, I'm listening to this call and I feel fine, I don't have anything going on, I would say you need to reevaluate what that means, because your body, when a healthy body is always going to give you feedback about the environment. A headache tells you something, an earache tells you something, an itch tells you something, an ache tells you something. When your body stops signaling and everything is quiet, that may not be a good sign. And so let's move on. Okay, so now you know not to be so happy with those over-the-counter drugs. Another drug that people take for arthritis is methotrexate or gold shots. And what these do is that subdues the bone marrow so you can't make platelets and white blood cells. That's really bad. I'm not even going to expound on that. All I can say is that's really bad, because that's a whole nother set of knowledge. And so what's happening with this? We're on section 4, so we're moving quickly. What's happening? 98% of all of this is nothing but a mineral deficiency. And rheumatoid arthritis is a combination of a mineral deficiency coupled with a bacteria. The body is constantly trying to process and to keep the joint strong, and the body needs raw materials to do it. And those raw materials can't be gotten from the food or received from the food, because the food can no longer get the nutrients from the soil, and it's just a big old mess. And so when joints lose their structural integrity due to lack of nutrition, the joints and the structural integrity, the joints start to break down. So basically, that's what we're talking about. And so the solution is very easy, but there's a very easy solution. Supplement. You must supplement. Everybody must supplement. It's not a choice. It's a mandate. When we don't, it's only a matter of time before stuff starts breaking down. And as consumers of healthcare, whether it's allopathic medicine or natural medicine, we have to understand and need to acknowledge that drug manages patterns of disease and creates additional problems, even when your doctor doesn't tell you the truth. And so when you know that there's something going on and your doctor is trying to give you a drug, you have to reevaluate that and say, wait a minute, what's the underlying cause of all this? Because the drug is not going to fix it, so there has to be something else. And there is. It's called 90 essential nutrients every day of your life, and that's the most important part about it. Okay. So I'm a naturopathic doctor, and so the naturopath way of thinking, and Dr. Wallach has truly been a trailblazer. When I grow up, I want to be like a Dr. Wallach. I only had 10 years in, about 30 years to catch up. And so he'll probably still be alive then, and we'll be able to corroborate someday and get some understanding of what's going on, because naturopaths are not curing anything. Naturopaths don't cure anything. Naturopaths don't cure anything. Did you hear me? Naturopaths. However, what naturopaths do is we are educators, and we teach people, everyday people, how to learn information to take care of their own bodies. And basically, the premise is, if you give the body what it needs, which are 90 essential nutrients a day, and you take away the bad stuff that the body doesn't need, it's going to heal on its own. It's going to heal on its own. And it's very simple. Dr. Wallach has put this idea out several times to a lot of different medical establishments, and a lot of them didn't take them seriously, and he's been able to overturn 7 out of his 8 lawsuits against the federal government about what we can and can do in terms of natural medicine and nutrition. And so there's a study that Dr. Wallach had said. He was saying, I watched one of his videos today, and what he said was, you know what, arthritis is an easy fix. 70 to 80% of Americans get arthritis in their lifetime, and according to the CDC, which is the Center for Disease Control, 35 to 60 million baby boomers will get arthritis in the next 7 to 10 years, and there is not a single medical treatment or drug designed to fix, prevent, or regrow the problem. Dr. Wallace said that's a lie, and he proved it. He proved it by healing arthritis in pigs. I thought that was phenomenal. And so if you think about inflammation in joints, it makes sense that whatever you give to an animal should work for people. It does. They test drugs on animals every day of the week before they give them to us, so why not test nutrition? And so Dr. Wallach made this claim, and the guys at Harvard Medical School laughed at him and said, you know what, that doesn't work, but we're going to try our own study. What they did was they took 29 patients who failed drug therapy, chemotherapy, steroid therapy, and who were slated for the guys were slated for surgery. And they said, okay, if Dr. Wallach's way works, let's prove that it doesn't. We're going to take the worst of the worst people, we're going to take them off all their drugs, and we're going to give them chicken cartilage in their orange juice. After 10 days, all of the 29 people were completely free of pain and inflammation. And they had been having pain for 20 or 30 years. And I'm a punk. I can't stand pain for a few hours. So 20 or 30 years of pain, I don't understand it. After 30 days of this regimen of just chicken cartilage in your orange juice, all of the participants were able to open up an unopened jar, which engaged the fingers, the wrists, the elbows, the arms. And anybody who has arthritis knows that it's very hard to open up a jar of anything. It's very frustrating. But after 30 days of this regimen, people were able to do that. After 90 days, 28 of the 29 were clinically cured. I don't know what happened to the 29. I didn't see the last part of the research. But what that means is clinical cured means a complete return of range of motion, no pain, inflammation gone in fingers, toes, hips, knees, and neck. Now, after that study was done, they agreed that what they had given worked. But instead of giving Dr. Wallach the green light to say he was right, what they did was they called the chicken cartilage a drug. They got a patent use for it to call it a drug, and that's how they called it. They didn't even give him acknowledgement for the discovery. Why did it work? Is because chicken cartilage has in it glucosamine sulfate, chondroitin sulfate, and collagen, and these are the building blocks of joints. Wow. And so this is how you can get rid of arthritis. Supplement 90 essential nutrients for life, because those nutrients and nutrient cofactors help rebuild collagen, help rebuild bone matrix and bone, help support the integrity of the joint. But it also helps improve your immune function. If you have rheumatoid arthritis, all you would need to do is get the proper antibacterial to kill the bacteria. And guess what? Your fingers will actually eventually start to straighten out if you have gnarled fingers. And so that concludes the arthritis presentation that I wanted to give you, but I always like to do a quick recap so you'll understand exactly what we just talked about. So you'll be well informed when you hear the term arthritis, you know more information and you know how to handle it. And so we went through the definition of arthritis, which is this inflammation. We talked about the anatomy of arthritis, which means you have 360 joints, which means you can have arthritis anywhere in the body. We talked about the cultural belief system, about it being genetic, but it's not genetic. Talked about it being about age, it has nothing to do with your age. Talked about it being irreversible, it is reversible. And so we got that out of the way. We talked about the treatments. The treatments are steroids, surgeries, and drugs, none of which work. All of those create additional problems which you don't need. Research finding has corroborated that, and the conclusion is, at the end of the day, if you want to be rid of, done with, completely erased out of your consciousness arthritis, take 90 essential nutrients for life and let God do the rest. We were made from the dust. The dust is minerals, and so it makes sense that everything that God has given us on this planet to be well, we already have. We probably just need to tap back into it and stop making things so complicated. So thank you for listening to me, and I turn the call back over to Mr. Lyle.
Dr. Reed, that is phenomenal.